For the best in eyewear, call Dr. Leak's Optometry.
Federal government has determined that there are opioid issues, and they're trying to address this. On a state level, there was a Senate, actually Assembly bill that was passed in 2017 that went into effect on January 1st, 2018. That put a whole number of restrictions onto the providers prescribing these medications. None of them are something that we can't work around, but they want us to be responsible prescribing and making sure we're not prescribing more medications for patients than what is safe.
So has this been going on for many years, opioid prescriptions, people using opioids, or is this something that we're just hearing about in recent years?
If you look historically, there's a couple factors to consider. One is that when I started practice, it was really unusual to write a lot of pain prescriptions. We use Tylenol with codeine primarily for pain control. Now we have so many strong pain medications that are being used because people say, I have pain, I need to be treated. But so we are writing many more times the amount of pain medication than we were, for instance, 30 years ago. But interesting, if you ask people and you look at the research, there's just as much pain now than there was 30 years ago. So writing more prescription pain medication does not decrease the pain in people in the United States. It's perceived that it helps them, but it does not when we look at this, and there's more overdoses and more people dying. Maybe 130 people every day are dying of an opioid-related overdose. A lot of those are done with illegal drugs, and a lot of reasons for that. They're more accessible, they may be cheaper, they may be cut off from their supply of this. So we do have a problem, and we analyze this over the years. This is becoming more of an issue than it was, for instance, 30 years ago.
So there's restrictions now with the insurance companies, with the pharmacies, with different healthcare providers?
There are restrictions specifically in us writing them, not the amount, not the concentration of them. Nobody's saying what we can and cannot write. We have to make sure that the patient has not been getting prescriptions from other providers, that they notify the patients of the risks associated with taking these medicines, that we give them the antidote. All of these rules that have been put in place by the state of Nevada are reasonable rules. They can be construed as being onerous and just too burdensome for the providers. But it's time that we accept our responsibility for what we've been part of, and the pharmacies are attempting to assume a responsibility for them as well, because there are pharmacists in the past who simply dispense too many medications. So the pharmacies are trying to work on this as well by trying to restrict the amount of prescriptions they give. Everybody has good intentions, although the person who is in the restricted supply of these medications feel that they're being singled out and that they are the ones who are suffering from this, when actually everybody's trying to make this better and keep patients safer and to prevent overdose deaths.